there. Okay, another little video for Stop What Sewing Library. We're just going to give you some hints and tips today as to how to fix some really common problems that we get asked quite a lot in the library. As you can see, I'm currently wearing an ergobaby Omni 360, and my baby is approximately 3 to 6 months, so it's suitable for that size baby. Now, you can see straight away that something doesn't look quite right here. I can't see my baby's head. The arms are really low down here. It's very low down on my hips. It's not really close enough to kiss. It feels very loose and slack. The waistband is sort of tipping forwards, and very often you get lots of people complaining about lower back pain. And it's often because of this, because the waistband isn't tight enough. So I'm going to start there. So I'm going to bring the waistband up and I'm going to tighten it up. Okay. So straight away, that feels better. Now, I think from this baby, on an Ergo 360, there are Velcro parts on the waistband that allow you to adjust the width for the size of the baby. Now, it's currently on the smallest setting, and I think for this baby, I actually need to put it onto the second set. It's going to struggle to do that whilst I've tightened the waistband up now, but I would do that next time before putting it on. I'm going to definitely fold this down because it's far too high up. We don't recommend that any carriers go above the top of their ears. So I'm going to fold this down straight away, and straight away I can see I have a bit more visibility on baby. Okay. There we go. Also, I'm going to get the baby's hands. I'm going to bring them up so that they're up near their face, so if they need to chew their hands they can. Next thing is, you'll see here the buttons. The Ergos have 2 buttons. So the outer button is the black one, which is for a forward facing in position and also on your back. The grey one, which is the inner position, is actually for forward facing out, which Ergo recommend from around the 5 to 6 months mark. So I'm just going to move that button inwards. What this will do is it will make the carrier wider and it will support the baby's legs better. Again, these are things that you would probably do before you put the carrier on, but it is possible to do whilst wearing. Okay. There we go. So, the other thing, if you look down here, I've got this strap which is quite tight across the back of my neck here, which is also quite uncomfortable. You can see that it's very slack here. If I lean forwards, the baby's going to swing away from me, and there's a big gap between me and the baby, and we don't want that. Particularly with a younger baby, what will happen is that the baby can slump down inside the carrier and the chin can end up on the chest and compromise the airway. So we need to fix that as well. So I'm going to lift baby up from the bottom here, and you can see here I've got loads of slack. So again, making sure the little arms are up, I'm going to tighten that up. Okay. Do that on the other side. And already that feels better. Now, going on to my strap here at the back, it's probably a little bit too high up. Now you can see on the webbing here that you can actually pull down this chest strap webbing. Now again, this is going to be really difficult to do when you're on your own, but you can do it before you put the carrier on. Because really you would want this strap sort of a bit further down near where your bra strap is, so that you can actually pull it. So again, I'm going to tighten it up a little bit. Now that's a much better position for this baby. So now you can still see that it's quite a large panel, this. So sometimes it says it's suitable for a newborn, but it's often not, because the panel is quite large. And like I said, we don't really want the carrier going any higher than the top of the baby's ears. A pelvic tilt is a really good way to make the baby's legs come up on the bottom drop and get that real M position. So the way you would do that is you would slide your hands inside the carrier, placing your hands around the baby's hip and tip. So it's a motion like this and tipping this way. Obviously, if the baby was on the forward facing out position, then you would have to slide your hand in and tip that way, so it's going away from you. And that will bring the baby's legs up. So that, to me, is a much more comfortable position. It's further up, it's sitting flatter across here. The waistband isn't tipped, it's taken the pressure off my lower back. It's now close enough to kiss. And I can keep an eye on the baby's airway, making sure that there's that gap underneath the baby's chin, and it's much more comfortable. As I said, maybe need to check that Velcro positioning when you take the carrier off before you put it on next time. But this is a much more comfortable and a better position generally for babies to be in. And most buckle carriers, you can do it in this position and not just the yig. Okay, thank you.